This is going to be for an antipsychotic for bipolar 1 and schizophrenia. It's a combination pill called Lybalvi. It's got olanzapine in it, which of course is not new, but it is combined with samidorphan. Samidorphan is an opioid antagonist, and then of course it's combined with olanzapine, a second-gen atypical antipsychotic. Reason being, not entirely sure. I don't know if you can shed some light, but it's used for bipolar 1 and schizophrenia. The samidorphan can help with the weight gain associated with olanzapine. I don't know if that's the primary reason it's in there.
So basically, the thought process is a lot of the comparative studies have have shown that olanzapine tends to actually be more efficacious, and I think a lot of the studies that I'm thinking of that had the comparative were with schizophrenia specifically. So olanzapine does seem to be a very potent and efficacious second-gen antipsychotic versus some of the others. But it's the metabolic syndrome side effects that become such an issue. The dyslipidemia, the glucose intolerance, the weight gain. It makes it one of those drugs that a lot of times we shy away from, especially if they have comorbid issues with cardiovascular disease or whatnot. So the thought process is we can still utilize the olanzapine, and the samidorphan is there to combat the side effects of that, so that we can basically utilize this better agent, at least in theory. I don't know that this one has been compared to. I haven't seen anything where it's been compared directly to other agents without any other active, ingredient other than just the standard therapies, but in theory it sounds like
I like the idea, though.
Option. Yeah,
I like it now that I understand. That's kind of what I thought, but I didn't know if there was something else to it. So that's good. I like that, and it blocks the mu opioid receptors, which is how it's going to kind of help with the decreased weight gain. But for patients who use opioids, you have to use caution, and they have some instructions. I won't go into all of it, but effectively delay the initiation of the drug for a minimum of 7 days after the last use of a short-acting opioid, 14 days after the last use of a long-acting opioid, and they give some more specifics as well. It can be used adjunct to lithium or Depakote. They have some dose adjustments there as well. But generally, I mean, it sounds like it's just olanzapine plus this opioid receptor, which not a bad idea.
Yeah,
I think that's a little innovative.
Yeah, for sure. I'll have to contact our buddy Patrick Casey if he's seen this come through at all.
And they still, I mean, the drug together is still going to have the side effects associated with metabolic issues, increased triglycerides, weight gain, all that stuff.
It's definitely not going to fix it completely.
Glucose, right. So hopefully it would just be a little less so versus plain olanzapine.